Today we're teaching how to auscultate breath sounds with a stethoscope. My name's Jesse, this is Lisa, she'll be learning today. So auscultating breath sounds is done for multiple reasons, usually to listen to the breath sounds throughout the lungs and trachea. Indications for listening to breath sounds are things like patients on admission to emergency departments, anyone who has a respiratory condition or needs monitoring of breath sounds, as well as a deteriorating patient with a chest or throat issue, as well as anyone who has unusual symptoms to do with the respiratory system. Auscultating breath sounds is useful because you can tell more about what's happening inside the lungs and the trachea than what you would without being able to auscultate. It also allows you to determine what may be going on in there, such as fluid in the lungs, a deflated or inflated lung, as well as the different types of wheezes and everything else you get. So there are multiple different breath sounds that you'll hear. Regular breath sounds should have a nice clear sound to them. They'll differ throughout the chest. So as you can see here, we've got vesicular breath sounds, bronchovesicular breath sounds, and bronchial sounds. So each sound has each area has a different sound. So a bronchial chest sound should be a bit louder. It'll have a definite pause between inspiration and expiration, whereas vesicular won't have so much of a pause, and it will also have generally a longer inhalation time and a shorter exhalation time. They're the signs of a good chest sound. Bad chest sounds would be any other extra noises or noises that differ from that, so things like a wheeze or a crackle. Crackles can indicate a few things wrong more in vesicular, and a wheeze would be more your bronchovesicular or your bronchial sounds. So when you're doing a chest assessment, you're going to be looking at the front, the anterior, the side, and the posterior areas, so you're going to be looking towards the back as well. Using a stethoscope is pretty simple. You'll have stethoscope facing forwards in your ears. We'll be using a diaphragm for this with a decent amount of pressure onto the area that you'll be assessing. When you are using the stethoscope for chest sounds, you want to be comparing each side. So you start on one side, move to the next, and compare those two sounds. So you can make sure you've got equal sounds on both sides. And then moving down in the numbers indicated there. So the spots, the first we'll check is the trachea to make sure that there's no abnormal breath sounds up there. Move down through the upper airway, the bronchioles there, and the lower airway, and it's similar on the back as well. We can also check the sides. So when we are doing it, we're going to be looking for any of those chest sounds that I mentioned earlier. When you are doing the assessment, you can have the patient sitting as usually comfortable, and just doing quiet breathing to start with. They don't need to take any big breaths. When you are auscultating, and if you can't hear the breath sounds completely, you may ask them to take a deeper breath every time you place the diaphragm down, and it may increase the volume a little bit, make it a bit more clearer. So just for an example, so normally we would expose the patient, we won't in this instance, but you're going to be holding the diaphragm of the stethoscope against the chest, as indicated, and keep a decent amount of pressure and ask them to breathe in and out. And then move across to the other side to check that they're equal. Yeah, so we'll have a go at that. Okay. So if you wanted to take this one, this was nice, a bit nicer. So for now we won't expose the patient. You could just use me as an example, and we will just do the front chest sounds. So you'll be listening across all of the locations there. So you're going to be up nice and high. That one's a little bit wrong because the trachea is going to be up nice and high in between the bone there. Once you've heard a clear sound, you move down to the next number, and then you'll start comparing each sides. So once you've heard all of the chest sounds on the the anterior side there, assuming that they're all clear and equal and making nice breath sounds, you move down to the side, which is sort of in just below, like under the armpit there, but into the bony areas there, in about the second or third intercostal space there. Again, assessing both sides, and then you'll move on to the back, which is similar, pictured similarly to this, moving in and out, checking the whole way down the lungs, mainly in the vesicular areas on the back. So if you want to go ahead and do that. Yep, so then you check the backs. It's easier if you get the patient to sit forward and you move to their back.
Okay. So just sit forward for me.
Yep. Lovely. So once you've heard all of the clear and equal sounds, you of course document accordingly what you've heard. So did you have any questions relating to? You'd be pretty happy using this in a clinical setting because it's even in your scope of practice. You'd be able to use it. You'd be pretty happy to perform a basic chest assessment on somebody. Excellent.
Thank you.
Thanks very much.